Hemorrhage control. Identify the severe hemorrhage. External bleeding that cannot be controlled by direct pressure. An indication to use a tourniquet may be external bleeding from an extremity that cannot be controlled by direct pressure, and multiple tourniquets may be required. Correctly applied tourniquets should block arterial blood flow. It is confirmed by the absence of a distal pulse. Contradictions of tourniquets are none in an emergency situation. Junctional tourniquets treat wounds that are located in the junctional areas of the body, where the extremities meet the torso. Committee on Tactical Combat Casualty Care approved a number of devices for these types of wounds. Some of these devices have been fielded by the U.S. military for use in combat. Air use in the civilian setting has not, as of yet, been defined. Examples include SAM junctional tourniquet, combat ready clamp, and junctional emergency treatment tool. There are two types of hemostatic agents. There is a powder that is poured onto the wound, and there is gauze that is impregnated with hemostatic material. Bleeding that cannot be stopped with direct pressure and is located on an area of the body where a tourniquet is not practical is good to use a hemostatic agent. The effects may be enhancing clotting when packed appropriately into a wound. Once applied, direct pressure must be held for a minimum of 3 minutes. Hemostatic impregnated gauze can be combined with the technique of wound packing for greater effectiveness. Consult with your local protocol.